Let's talk about follow-up care. Depending on why your baby was admitted to the NICU, depends on what follow-up care they're going to use afterwards. Every baby has got to have a pediatrician's appointment before they're discharged. Usually it's 1 to 2 days. The only time we let it go as far as 3 days is when your baby is discharged on a Friday. We let you go till Monday before the follow-up appointment's made. Now, besides your pediatrician's appointment, if your baby was a very early preemie, they may have a doctor's appointment with the eye doctor. That is a very important appointment to keep, and they will continue to see that eye doctor for several follow-up visits after discharge. And the third follow-up appointment that some babies will have is either the Developmental Care Center or Dr. Trainer. She's a physiatrist who goes and sees your baby and makes sure that they're meeting all their milestones. She can order occupational therapy, physical therapy, speech therapy, everything that they need, okay? As far as the developmental care clinic, that appointment is an hour and a half to 2 hours long. That appointment takes place about 2 to 3 months after your baby is discharged. There you're going to see a dietitian, a speech therapist, occupational therapist, physical therapist, a social worker. You're going to see all the different modalities in that one appointment. Some of these appointments are very important, so much so that if you don't make those appointments, they can actually consult Department of Human Services, DHS or DCS, if you totally skip those appointments. That's how important they are. It's really important for you to limit your visitors for at least 4 to 6 weeks after you take your baby home. Especially if the baby was discharged from the NICU. NICU babies have a 50-50 chance of being admitted back into the hospital at some point during the first year. So to help prevent that, we want you to keep your baby at home. If your baby is going to be on WIC, the WIC office is going to tell you to bring your baby to them for that first visit. You say, okay, don't argue with them, but we're not going to have you take your baby to the WIC appointment. That waiting room is just a hazard for brand new newborn babies. So instead, we're going to give you this letter that says that this baby was in the NICU and we recommend that they not take the baby to the WIC appointment. They will accept that letter and go ahead and do your WIC visit, and from that point on, you'll have to take your baby to that visit. If your baby is going to go with you to your visit, we highly recommend that you just keep them at home. We know that the office wants to see your new baby because they've been seeing you and following you for the last 9 months, but for now, just show them pictures on your phone and leave your baby at home. That's the safest place for them. The 3 things we worry about visitors coming into our home. The 3 things are stomach bugs. Unlike the flu, a stomach bug does not have a season. You can get sick 365 days a year. So they can say, you know, I stopped at Taco Bell on my way here and it's just not sitting well, and it's probably the Taco Bell, but it could also be that your visitor is coming down with a stomach bug, and you can't risk getting a stomach bug for a little tiny baby. The other thing we worry about, of course, is the flu. That's very important, especially now. But with the flu, it usually has a season. They can say it's these East Tennessee allergies, and it probably is the allergies, but you can't take that chance. So we're going to tell them, I know you've driven a long time, but you can't see my baby. I'm sorry, I can't take that chance. And the last one, and this is the one that nobody really thinks about when it comes to their visitors, are things like rashes. And the main one we worry about is hand-foot-mouth disease. If your baby gets hand-foot-mouth, they can actually get blisters literally on their hands, on the bottom of their feet, and in their mouth. If they get blisters in their mouth, they're not going to eat because it physically hurts them to suck on a bottle. If they don't eat, you're going to have to feed your baby with a medicine dropper, and chances are your baby's going to end up in the hospital on IV fluids. The only other one we worry about really is Fifth's disease, but hand-foot-mouth is the number one. So we need to have a parent that feels comfortable making sure that their visitors don't have any rashes. But of course, the number one thing that anybody can do when it comes to taking care of their babies and keeping their babies safe is washing your hands. You can't wash your hands enough as far as we're concerned. And I recommend washing your hands good with soap and water, and then having some hand sanitizer wherever your baby's going to be so that they can also sanitize their hands before they touch your baby.